Well, there's a code blue in America when it comes to having enough doctors. We're short on doctors. We're short on nurses. We're short on hospitals, closing all the time, by the way. More than 200 hospitals have closed in America in the last handful of years. 600 today are in financial trouble. What does that mean for your health care? Well, it's a problem. And what about having enough doctors? Jonathan Wolfson is the Chief Legal Officer and Policy Director at the Cicero Institute. Sir, good to have you here.
Good morning, Steve. Thanks for having me.
Greatly appreciate it. And one of your solutions for the challenges we face in healthcare, and they are many in America, but you say foreign physicians can help solve America's doctor shortage, and there are too many extra rules for people to come here out of the country. Iowa and Virginia have joined a list of states eliminating extra training as a licensing requirement to practice medicine in America. I think you have to explain yourself here, because I don't think people are just going to jump on board, because a lot of folks are going to say, wait a second, the doctor's not coming from UCLA or the University of Michigan or wherever they might come from, and so we want to make sure that they're qualified to practice medicine in America. But you have a different opinion. Why is that?
Yes, Steve. Well, as you mentioned at the beginning, there's a massive doctor shortage. There's a shortage, as you mentioned, across the entire healthcare industry of healthcare professionals. But one of the challenges is that in the United States, in order to become a doctor, you have to not only complete medical school, and we let you do that anywhere in the world, but you have to complete residency here in the United States or in Canada. And that means even if you are an orthopedist who treats the knees of every skier around the world on the World Cup Tour, if you wanted to move to Utah to be the U.S. ski team's orthopedist, you'd have to repeat residency. So we're not even talking about doctors who there's questions about their training and experience, but any of those doctors would have to repeat residency. And this would be fine if we had tons of residency slots sitting around and no one was filling them. But the reality is we capped those in the 1990s. And as a result, we don't have enough doctors coming out of residency to meet the shortages.
Well, that's because we don't pay enough money. The bottom line is, to be a doctor today, to be a resident, about 150 grand. That's about the time you turn 30 after you get through medical school. And you might have a couple of kids. You might be married at that point. You might want a nice car by the time you become a doctor, or a house that's reasonable for your family. And at 150 grand, you've got so much debt, you might not be able to have those things because you're so far in debt, you can't service the mortgage, service the student loan debt, take care of your spouse, get your kids off to school. So 150 grand is not very attractive. That's the problem, isn't it?
Well, the pay for doctors definitely is a challenge in trying to get them that money. But one of the other challenges is that the number of doctors who we have in the United States is not going up very fast. It's actually about to go down, as we see about a third of doctors in the United States are nearing retirement age. And as they step out of the workforce, whether full-time out of the workforce or even part-time, we're going to start seeing the shortages get even worse. And so our solution,
Yeah, so I just want to talk about your solution here. Okay, so you talk about the orthopedic surgeon who wants to be for the U.S. ski team in Utah. Good example. I appreciate that. But there has to be some threshold by which a doctor can say, okay, I can not have to go through residency again. I am qualified because of X. I mean, there have to be some standards, obviously. What are they?
Yeah, that's a great question, Steve. And I think that our proposal is focused only on eliminating that unnecessary redundancy in residency. We say every doctor who comes to the United States should still have to have completed medical school, have completed a residency somewhere in the world, have to have at least 5 years of medical practice without any sort of disciplinary issues. They have to pass the exact same exams, the USMLE exams, that we require every doctor who is practicing in the United States to have taken. We also think that they should be sponsored by a healthcare facility and working under the, not direct supervision, but along with a team of other doctors for their first couple of years. So the bills that we had the privilege of working on in Iowa and Virginia, as you mentioned, and in other states around the country, all require that these doctors have kind of a second check of their credentials from the facility that they're working for. So the hospital they're going to work for, the practice group that they're going to work with, is going to sponsor them and actually take on that risk and liability of working with them. So that's the only requirement that we think should be different, is that they shouldn't have to repeat that residency training. Everything else looks exactly the same and gives the medical board the ability to verify that these are the best and brightest doctors from around the world who would come and practice here.
You have to reach a minimum threshold of competency, hopefully beyond the minimum requirement, but you have to have competency to deal with patients. Let me ask you this. Are there certain areas where you have a bigger shortage? Is it family docs? I mean, internists, not very attractive. You know, people want to be specialists because it pays more. Everybody wants to be a plastic surgeon because it pays $1 million a year if you're in a good place, right? But being a family doc, again, if you start at 150, you might get up to 250. But, you know, doctors don't make the kind of money relative to the rest of the population that they once did, Jonathan, and that's part of the holdback. So where is the biggest need?
No, I think you're absolutely right. So, you know, Michigan is projected to be about 900 primary care docs short by the end of this decade. And, you know, there are a number of counties, about 72 of 83 counties in Michigan are health professional shortage areas. And this is mostly focused on primary care. And so you're absolutely right. What you need is folks who are going to be general practitioners, pediatricians, OBs. These are the types of practices that, to your point, are not paying as much as other professions or other parts of the profession. And so finding ways to bring in additional providers in those areas is critical, because otherwise you're going to have people having to travel hundreds of miles in order to get access to care.
Also true, but that's going to be true because labor and delivery. Many hospitals in Michigan and across this country have gotten rid of the labor and delivery departments because they're expensive to run. They have a high incident of lawsuits and so forth, so they've just eliminated them. Having a baby is not as easy as it used to be, but that's a conversation for another day, I guess. Jonathan Wolfson is the Chief Legal Officer, Policy Director at the Cicero Institute. Jonathan, thank you for being here. You come back anytime because these are very, very important topics that people need to understand that their health care is threatened from a lot of different directions that they might not even consider. Thank you for being here.
Thanks so much, Steve. Have a great day.
You too, my friend. Thank you.